When you say about food consumption, right? One of the biggest thing is about the link of usage of oil and heart disease. What is this about? Do you see a lot of patients coming to you with no knowledge about oil usage, or why is this a big deal?
So this is one of the most common questions asked to us. Sitting in a cardiology clinic, people first question there, sir, what should we eat?
Yeah.
It's not that what should we not eat. It's just what should we eat. So oils are commonly linked with heart diseases because of the long-standing thought process, marketing about it. But it's not just oils. People are usually correlating saturated fatty acids and saturated oils with heart diseases. And these days, marketing advertisements, I would say, I don't know who's doing it, whether it's marketing agencies or whether it's food consumption agencies or food manufacturing agencies, whosoever is doing it, they link that if it is unsaturated fatty acids, it would not cause heart diseases. They say there is heart disease safe.
So educate the audience about the saturated and unsaturated. So think of me as a layman and explain in layman terms in terms of what is the saturated and what is unsaturated fat.
So we'll go back to history. 1918, 1920s, how did unsaturated fatty acids or unsaturated fats come into picture? It was all animal fat then. Then came vegetable fat.
Animal fat is from chicken.
Animal fat is from any ghee, vegetarian, and from chicken, meat, that is animal fat. Most of it is saturated fat. Then came studies about unsaturated fatty acids when vegetable oils were being promoted. That was a mixed blend, whether it's saturated plus unsaturated fatty acids. There were several experiments being done.
Vegetable is from the vegetable oil.
From the vegetable oils.
Example?
Like soybean, like palm, like olive. These are vegetable oils, like coconut. These are all vegetable oils. Animal oils are from milk, from chicken, from beef, from any animal source. That is animal fat. So when this was being promoted, there were several experiments which happened and which said that saturated fatty acids might be is a strong word, might be causing coronary artery disease. There was an experiment in Russia which said that when rats are fed saturated fats or unsaturated fats, unsaturated fats cause less atherosclerosis. Atherosclerosis is deposition of plaques in the coronary artery disease. But many things were missed, that how was it fed, to who it was fed, to which rat it was fed. All this information needs to be rethought about. And then there was an experiment called Minnesota Coronary Experiment, 1960s, late 1960s. That actually de-linked saturated fatty acids to coronary artery disease.
When you say de-linked?
They said there's no positive or negative correlation. It's an independent factor.
What does that mean?
That means that if you have saturated fatty acids as the part of balanced diet, as per recommendation, saturated fatty acid should be less than 10% of your normal diet. If you have that, if anybody has that, there is no correlation between the saturated fatty acid content in the food, which could be anywhere between 5 to 10%, 8 to 10%, 2 to 10% versus coronary artery disease.
That's a very important point. Let's take some time about it. So I also agree that the amount of saturated fat should not be more than 10% of your diet, which means 10% of your total calorie intake.
Yes.
So let's say your calorie intake is 2000, 10% is 200. So 200, 1 gram of fat is 9 calories.
9 kilocalories.
So 200 divided by 9 will be your amount of grams of fat.
20 grams of protein.
20 to 22 grams of fat.
Yes. 1
tablespoon of oil, regardless of whichever oil it is, it's 120 calories. It's around
5 ml. 1 tablespoon is 5 ml.
Correct. Yes. 5 ml is 120 calories, which comes around close to 12 to 13 grams of fat.
No. So it's 5 ml. If the density is taken, it's less than 120 kilocalories. It's not 120 kilocalories. It would be approximately 8 to 9 ml, which would cause 120.
I see.
the spoon size also differs for all of us, right?
Correct.
So let us say if we want to have 20 grams of oil, it would be nearly 4 teaspoons.
4 teaspoons, correct. A tablespoon is a bigger amount. So one serving is like 1 tablespoon of oil is like 120 calories. So if you have 1 tablespoon, it's already like 12 grams or 13 grams, close to. And you only have remaining 7 grams left. So, and that amount of saturated fat is depending upon what kind of calorie intake that you're planning. So it cannot be like a one size fits all.
Yes.
And that's a good point that you're bringing it up. As long as it is within the 10%, the link with heart disease is not significant, is what you're saying.
That is what the studies have said.